Hi, everyone. I have a really special guest here with me today. This is Anthony Floric. He is president of Soundwave Hearing. Chuck and I first came across Soundwave Hearing when we first heard about OTC hearing aids hitting the pharmacy space. And I thought, this sounds like a real interesting point of care test. And then Chuck told me, he's like, yeah, there's this really cool company in Chicago that literally has a device the size of an iPad. You could take it anywhere with you and do hearing screens. And I thought, oh my gosh, this is an amazing opportunity for pharmacy owners to jump in this space, help people in their communities. And that's how me and Chuck met Anthony. And we're so happy that we did. Chuck and I have actually taken this test ourselves and found it to be really super easy. We've done it at our kitchen counter in under 3 minutes. We're able to get the results and interpret the results more importantly. So without further ado, I will let Anthony take it away.
Great. Thanks, Tara, and thanks for Point of Care Testing Institute for inviting Soundwave Hearing. Anthony Floric, President and CEO of Soundwave. I've got a presentation for you this morning that talks about really a new clinical service called hearing loss. And I thought I'd just talk a little bit about our mission-driven business model and our hardware solution, our software solution, and then the oToTune Assistant, which is the point of care test that Tara is referencing. Just talk a little bit about the marketing materials and our training and ongoing support, and then an introductory promotion between both groups. So simple, affordable, and convenient is our mantra, and simple because the folks that buy a hearing aid from your pharmacy, an OTC hearing aid like the Santro, can sit down and take the test and program their hearing aids at their kitchen table. They can take the point of care test in your pharmacy in less than 3 minutes to give them an indication if they're a candidate for an OTC hearing aid. Affordable because it's 75% less than prescription hearing aid. It's $800. It retails, our base model retails for $849 for the set. Comes in 2 colors. Super easy and affordable for the patients, for your consumers. And convenient because they can do the test themselves. You can administer the point of care test to help them understand if they have hearing loss, and then if they are a candidate for an OTC hearing aid, they can take the hearing aids back to their kitchen table and do it right in the privacy and the comfort of home, which is really helps overcome some of the stigma that's associated with hearing loss. So this is our hardware solution, super simple as a leather case set of hearing aids. The blue tip indicates that it's for the left side, red is for the right side. Comes with a set of batteries, again, our base model, different size ear domes, cleaning brush, receiver measurement tool, etc. So this is an FDA registered Class 2 medical device under product code QUG, as registered again by the FDA. It is a very modern design, is a very good digital signal processing, which is the chip that processes the sound. Very clean, very crisp, and it has 16 channels, and it's got a lot of features that prescription hearing aids have, like wide dynamic range, compression, adaptive directionality, all those sorts of technical terms. But most of the consumers that are interested in an OTC product, they're probably a first-time user, and they don't really understand that sort of those descriptions necessarily. So we're going to designate our technology by terms and conditions that they do understand, which is Bluetooth and streaming and rechargeability. So this product, our base model, the Model AI, has Bluetooth technology, and it's battery operated. And it'll be the lowest cost. And then our next generation product will stream, and it will be battery operated. That'll happen in October. And then we'll incorporate the rechargeability and streaming with our AI RS model, and that'll be available probably at the end of the year. So 3 price points, generally between $800 and $1,000. If it gives patients choices and choices that they understand with how we designate our technology. So I'll talk a little bit about streaming because that's our next enhancement with the Santro OTC hearing aids. So it's optimized for streaming, super important for patients because a lot of the patients that have a hearing impairment use, speech read or read people's lips. So if you're on a Zoom call, on a phone, and you can see someone talking, or on a FaceTime call, etc. So super helpful. They could stream a podcast. It's not really optimized for music. They could listen to it though, as well. And yeah, so super easy to use, super easy to adapt to, super intuitive. And if they've used a Bluetooth technology or streaming technology with earbuds, etc., they'll be a pro at it in no time. So, and then this is really what we want to talk about, which is our oToTune assistant. So this allows healthcare providers to conduct a 3-minute hearing test with consumers in the privacy of a consultation room, ideally. The more quiet the place in the pharmacy, the better. It's an Android tablet. Comes with a cover and a calibrated noise isolating headphones. And the headphones and the sound card in the tablet are calibrated for our test. It's pretty inexpensive. It's $350 for the headphones and the tablets. Then there's a licensing fee after the first year, just to help with keeping everyone updated with the software and any updates in our user interface. So it comes with unlimited testing. We're not going to test you. We're not going to charge you per test. So we've really transferred this test that is with our Soundwave hearing aids and with the oToTune assistant. Uses a bunch of fancy processes, and I hopefully no one asks questions about them, but Gaussian processes and Bayesian non-parametric formulas to actually tabulate someone's hearing threshold. So it's going to be published. We did a clinical study with it. It's going to be published in scientific reports. It's a Nature journal. It's a peer-reviewed journal. We got accepted for publication. It should be out in September. We're super excited about that. And we've really transformed the hearing test. If most folks haven't had a hearing test since 2nd grade, but if you remember, you'll go in, if you go to an audiologist or ENT's office, and you go into a sound booth, you put on a set of headphones, they put a little clicker in one of your hands, and there's an audiometer and an audiologist on the other side of the window, and there's 6 basic frequencies from 250 to 8,000, and then a bunch of intensities within each frequency, and then the left ear and the right ear. It takes like 15 or 20 minutes to perform the test, and they do one ear, one frequency, one intensity at a time, and then you click when you hear the sound. It's pretty simple, and we do the same thing, except we've changed the rules because of all the machine learning that we use. It's automated, and when a tone is played in the left or right ear, the consumer presses the left or right button on the tablet or on the phone if they're programming their hearing aids. And it takes, again, about 3 minutes, and it's super easy to use. We actually tested it on 3rd graders, so I know a 3rd grader can use it. Doesn't mean a 58-year-old person can, but most folks seem to figure it out with some basic explanation. So it's quick, it's accurate, it's clinically verified, and we're going to make this tablet also HIPAA compliant, so that you guys, the pharmacies, can collect data and then retarget those customers that may not be ready for a purchase of an OTC product on that day, but they may come back, within a week, a day, a couple months, depending on where they are in their journey. So the first question pharmacists have asked me is, how do they know if someone has a hearing loss? And this is a way to find out. So that's our tablet. And once you would purchase the tablet, I would spend probably 30 to 45 minutes on the phone on a Zoom call, training you all and your staff. It's really easy to use. I go through the setup and then the results. And the results are we do it. There was different ways that we try to express results. The first way we did it was to give someone their actual hearing threshold, which is what they would receive at an audiologist's office. So that's a little more confusing. The consumers didn't quite get it, so we decided on just an A, B, C, D, or F score. So if they were to receive an A, that means that their hearing threshold was normal. Doesn't mean that they couldn't still benefit from an OTC product because they might have trouble hearing in a noisy situation. Speech and noise is the toughest situation for comprehension for even with someone with what they call hidden hear loss. or normal threshold. But if they flunk, that means they have a severe or profound loss, and that they would need to seek help of further testing from a hearing care professional. And I would encourage you to form a relationship with an ENT and audiologist, a Belton or Miracle Ear store near them, near your pharmacy, so you can refer patients. And if they get a B, a C, a D, or some combination of that, they would be a candidate for an OTC hearing aid. So pretty simple, sort of 3 buckets, easy to interpret, easy to explain to a patient. And that's part of our mantra, is to keep the testing simple and easy for the consumers to understand. So, and then our marketing material is again designed to be simple as well. We have a counter card for your pharmacy counters. We got bag stuffers, which are on the right. Again, pretty easy to copy in your pharmacies and make your own. We've got a patient brochure that talks about what's in the box, the requirements of the technology of a phone. So they need a fairly recent Android or iOS phone, Apple phone. So it can't be an iPhone 4 or the first Android phone out there. So they do need a smartphone to program their hearing aids. I think that's, it talks a little bit about Amplify in our oral rehab program as well. So if they were to buy our hearing aids and from your pharmacy, they would sit down and at their kitchen table, take the hearing aids out of the box, put the batteries in, download our oToTune mobile app from either the Google Play Store or the Apple App Store, and then register, because it's an FDA requirement, and take the tutorial. And they have the opportunity to sign up for Amplify, which is, again, our oral rehab app. So we're not just giving your consumers a device that amplifies, even though it's customizable and programmable. They may not have heard specific frequencies for a while, depending on where they are in their journey. Could be years, certainly months. So the oral Amplify helps them retrain their brain on how to listen to those frequencies if they so choose. It's an optional program. It's 12 weeks. It's the first month is free, a $50 value when they download the oToTune app. And it comes with a hearing health coach. There's a peer support community, so they can interact with people that have hearing impairment. Super supportive for those consumers. Has what we call brain training games. So it helps them teach them how to overcome a communication breakdown, how to become a more effective listener, how to speech read, some of the skill sets that will be helpful for them. So amplification, customizable amplification, and oral rehab, if they so choose, is sort of what makes our technology different, right? The customization, certainly it's a lot different than what other hearing aid companies are doing. So a lot of them offer what we call pick and clicks. It might be 3 or 4 programs that they hope cover someone's hearing loss, but what can be really frustrating if hearing aids amplify sounds or frequencies that someone doesn't need, or it's not amplifying the sounds that they do. So our self-fitting, customizable approach is very specific to that patient's hearing loss. And when they take the hearing test with the oToTune app with the hearing aids, they just hit program, and then they're sort of on their way. So we can go through more of that at the end. I've got a couple of screenshots to show. So we have an acrylic display that actually shows the hearing aids. That's something an idea that came from the pharmacies, because people like to see what they look like. And just for a little closer look, I have one right here. This is how 90% of the hearing aids are sold. It's the amplifiers in here. There's 2 microphones on either side of a toggle switch, and then a speaker, which they call a receiver. The blue indicates the left side. It sits comfortably behind someone's ear, even if they have glasses, which a lot of people do at this age. And the receiver just goes into the ear canal. So very conspicuous design, super light, and super small. And people seem to like that design. And the acrylic display is just one way to kind of show them. We have an email campaign as well. So the pharmacies can send out emails to their consumer base to generate interest. We have a poster that I don't have shown here, but I can send you a poster for your windows or your doors that, again, just generates some interest that, hey, you are now performing another clinical service. You have another new point of care test, which is awesome. And then, I talk about what the pharmacy's responsibilities are. It's just generating interest, right? It's the in-store marketing, it's the counter cards and the brochures, and just to gain traction, right? And you might do it online. Certainly you'll do it in your stores. And then testing, right? I think word will sort of spread in your community once people understand that you are performing this test. Sarah probably will talk a little bit more about how you guys charge and different ways to do it, but most pharmacies are charging for that point of care test, for the hearing test. Some folks are starting to set aside, a hearing health day at a specific time and dates in their pharmacy, or maybe it's once a week or once a month, again, to generate interest. And then Soundwave pretty much does the rest. We'll ship you the oToTune Assistant. You sign up for a wholesale account on our website. It takes about 3 minutes. And then I myself and another gentleman, Chris, does all the training. Pretty simple. We're flexible on times, morning, noon, night, whatever is easiest for your folks, your pharmacy technicians. Anyone can really give a test. There's no qualifications really necessary. It's a simple test. The results are simple. It's like putting a consumer's arm in a blood pressure cuff. It kind of takes a test and gives you a result. We have a Midwest-based customer support team. I handle all the questions from the pharmacies, typically, Chris and I, on the point of care test with the oToTune Assistant. And then if you start to sell an OTC Central product, and then we have, again, a Midwest-based customer support team. We have hearing health coaches. We've got Zoom calls. So we try and support the consumer in different ways. Sometimes pharmacies will tell me that their consumers will go back to the pharmacy to ask questions, and we can also train on that as well. It's a 45-minute training, super simple. The biggest struggles that consumers have are, I can't connect to my phone, which generally is easy to solve because their hearing aids are connecting to another Bluetooth device. My hearing aids were working and now they're not, which means they're not cleaning them properly. There's earwax in their eardomes or the wax guards, or the receivers seems to be falling out. And maybe I'm getting some feedback, which means they probably need a little different size eardome to fill up their ear canal. That's 99 out of 100 calls that our customer support team take a day. So pretty simple, pretty easy to train on, and we can get a pharmacy set up rather quickly. So this is our promotion, right? And we've done this a couple different ways. I'm interested to see how this promotion works. The way we used to do it was, hey, buy 2 hearing aids and get the tablet accessory for free. Now we're saying, listen, buy the tablet and the acrylic stand and a set of non-working samples, and we'll give you a hearing aid for free. And I think so you'll net $349 when you sell your first hearing aid, and I think gets people excited. They don't have a lot of inventory. We recommend that pharmacies stock 1 or 2 sets of hearing aids, just because it's an emotional sale a lot of times, and if you have the product right there, it seems to get traction. And once people program and customize their hearing aids to their hearing loss, and actually try it and listen to what they've been missing, especially if it's a granddaughter or a loved one or their spouse, the TV's not so loud, it tends to stay in their ears, as we like to say. So that's the promotion that we have. Again, you can and Eric can send out this deck if she hasn't already. It's you can go right on our website, sign up on our wholesale page. Questions about the program, you can direct to Tara or myself or Chris Six. There's our information below. And that's pretty much it in a nutshell. I did want to cut to Tara, if it's okay, just to kind of talk about the hearing aids a little bit as well, and the oToTune app. So these are our 4 main screens, and there's a tutorial on the front end, the back end, and sort of in between. But the main screen on the left is just, hey, connecting their hearing aids to the oToTune app. So making sure that they download the oToTune app, which is important because the hearing aids really don't work unless you customize them to that specific consumer's hearing loss, and then connecting the left and the right hearing aid. So pretty simple to do. Occasionally, though, if there's another phone in the house or nearby, another Bluetooth device, they can struggle with that, but it's pretty correctable. And then they'll eventually get to our hearing test screen, and they just hit new test. And then the left and the right button, you can see sort of in the middle there. That's what our testing screen looks like. So they need to put the hearing aids, make sure the hearing aids are on their ears comfortably, and the domes and receivers fit properly. Pretty easy to do. We send the hearing aids with one size fits most receiver sizes. If they need a shorter or longer receiver size, they can certainly call us and we exchange them at no charge. It comes with a complete set of ear domes inside the leather case. So if the ear dome or receiver is falling out, probably need a larger ear dome, or if it's uncomfortable, smaller ear domes of different sizes for different shaped ear canals. But the tones play on the left and right side. It takes 3 minutes. There's a progress bar on the bottom that kind of shows them how far they are in during the test. If they get disrupted during the test, they can just hit cancel test and restart. Before this screen, there's a noise meter that says, hey, make sure you're in a quiet room. If it's too noisy, go to a more quiet room. In this test actually will give the consumer a pop-up warning message if they fall outside of the FDA indication. So our hearing aids are, again, an FDA registered Class 2 medical device. We follow all the FDA guidelines for mild to moderate hearing loss. You know that it's an OTC hearing aid because the FDA makes you say it on the box, right? So it'll say OTC product with all these labels. This also comes shrink wrapped. So for when you order them. So yeah, and that's the hearing test. And then the screen on the right is our control screen, right? So we try to keep it simple. There's 4 modes. There's quiet mode, which there's 2 microphones, so it's omnidirectional. If a consumer is sitting talking to their spouse at their kitchen table, they'll have it in quiet mode. If they hop in the car, go to a restaurant, it has what's called adaptive directionality, so it'll monitor the environment. If it hears background noise or speech babble behind or in front or on the sides, it'll lower those frequencies. It'll focus on the frequencies of the person talking in front of them and amplify those sounds. So it's speech in noise or using adaptive directionality. So it's a smart hearing aid, a smart system. And then if they hop in their car, come back home and they're watching TV, the microphone, and they'll go to entertainment mode. The microphones have a fixed degree in front of them to focus on if they're watching a movie or in a movie theater or at a TV, et cetera. And then automatic mode, which will constantly monitor the environment and switch to those modes depending on where they are. So we just tell people to put it, take the hearing test, program it, put it in automatic mode and sort of set it and forget it. There's a volume slider that's set at about 75% of the amplification needs that they want, because most of our users are first-time hearing aid users, and if we give them too much amplification all at once, that can be a little challenging. So we allow them to have some flexibility to adjust their volume, again, depending on their listening environment. There's an equalizer button on the kind of the bottom left. There's a mid, a bass, a treble. The bass are sort of, if they want a little more amplification in the lower frequencies, think of a truck rumbling on a road, or the mid frequencies are speech, so typically between 2,000 and 4,000 kilohertz, and the high frequencies, think of a child speaking or birds chirping, etc. So if they have too much or they start to get a little feedback, they can play with those volume sliders. So that's pretty much it in a nutshell. So I'll stop there, take a pause. That was about 25 minutes or so. And I don't know if there's any questions that, Tara, that you might want to talk about or ask me or prompt me. I can give you the folks a little background on me that might be helpful, that I'm not just some guy off the street. That maybe I'll do that. I probably should have done that in the beginning. But I've got 30 plus years in medical devices. I used to sell cataract implants and phacoemulsification equipment to the ophthalmology community for about 15 years. And then I joke, I started to work my way down the body, and I got into hearing with a company called Belltones, a retail hearing aid company. So I ran they had about 1,500 locations across the country in North America. And so I managed that branded network, our corporate stores, sales, training, business development, managed care, administration, all that kind of fun stuff. And then I went on my own at the end of 2016, met a group of guys at a health tech incubator in downtown Chicago called Banner. They got about 250 startups there. And this group that was from Resonance Medical was putting together hearing tests on a mobile phone, which was interesting to me because in the background, this whole over-the-counter hearing aid act was happening. And lo and behold, it became a law in 2017, gave the FDA 3 years to write the regulations. They took 5 because this little pandemic happened in the middle of it. In the meantime, I was in the background helping to license the software because that's all Resonance Medical had. And then I decided to venture out on my own in 2018, form Soundwave Hearing, finish the patents. I actually bought the software. I got all our family of 5 patents issued around our fitting technology. Also developed and built a hearing aid. So we design, engineered, and we assemble our hearing aid here in the U.S. and which I think resonates with certain consumers. So we're not licensing or sourcing a product overseas. It's our own hearing aid with our own proprietary technology. So we put it all together. We went to market in about 18 months ago. The regulations were published in the Federal Register in October of last year. So about 9 months old at this time. And it's really kind of a new category. There's 2 levels of OTC hearing aids. QU G is what we're grandfathered into as an OTC product. And then there's about 5 or 6 companies that have self-fitting, which is a QUH designation, which we did a clinical study for and submitted a 510(k) application for. And we're waiting to hear back from the FDA on that clearance. And if we got it, we'd be one of the few OTC hearing aid companies that are out there that have that designation. Super, super important to us. We're super excited about it. Our study, again, will be published in the scientific journal. So we have some peer-reviewed clinical study as well that says, hey, this is a really interesting and innovative way to test someone's hearing. So a lot of tailwinds with this, they say 10,000 or so seniors turning 65 every day for the next 8 or 10 years. The regulations, certainly the advancements in the Bluetooth technology, advancements in the power of the phone, all this machine learning kind of came together with some tailwinds that I think present a really nice opportunity for folks in the pharmacy community. Okay, I'll take another breath. Might be a good time to stop and ask questions. I'll just stop sharing here. I can always come back to it. Terry, you're on mute. Yep, there you go.
Yeah. Thank you, Anthony, for that presentation. There's so many reasons I love this. And, as we start talking about, health fairs are coming up, vaccination season's coming up, a lot of people will be going out in their community, and you have that 15-minute dwell time with a patient who's getting a vaccination, who, like you said, hasn't had a hearing test since they were in elementary school. This is a perfect time to sit down with them and go, hey, let's take some time. Let's check your hearing. Let's see where you're at. Another thing I love that I know there's a lot of companies out there and that others don't do is, you can have way more hearing loss in one ear than the other. So you have one-sided hearing loss. And this is a great opportunity for you to really serve your community and make those partner relationships, like you were mentioning earlier, Anthony, with the audiologist in your community. And in some communities, that might be someone that's 50, 60 miles away. So,
Right.
It's not really easy for a lot of patients to go out and see an audiologist, but this is something you could say, hey, one ear test A and the other one test D. Let's retake it and make sure it's correct. Okay, we got the same result. Let's refer you on. Because the other portion of this that we know is that hearing loss is the #1 risk factor for developing dementia, which of course will lead to Alzheimer's and that catch-all category. So, if we can help people with their hearing loss earlier, we can stop this progression. So I just want to put a plug in there for the application of this. It's so cool. And, like you showed the device, it's so small. You can, take it anywhere. You have a private area in your pharmacy, take the patient over there. I mean, the headphones, they fit so well that it blocks out a lot of noise unless you have someone chomping on food next to you. Then yeah, that's a problem. But this is something, it doesn't have to be at the front of your pharmacy where everyone watches someone take a hearing test. This can be in a really private place where the patient has the ability to put the headphones on and just have that moment of calm, and so they don't have to hear everything going on inside of a busy pharmacy. I do have a few questions for you, Anthony. And we were kind of looking at the economics of the hearing aids. Can you tell me again, what is the wholesale and the MSRP?
You bet. So the MSRP for the set, so 2 hearing aids, are $849 for our base model, our Model AI. It comes in 2 colors, gray and beige. And then the pharmacies, the wholesale cost is $675, so they make $174 or 20% margin on the sale. Yeah.
Okay. That's great. That's way more than you're getting on prescription. So,
yes.
And more importantly, talking about the economics of hearing aids and, the technology, a patient goes to an audiologist and they say, okay, well, you have hearing loss, you need hearing aids. Those usually start at $5,000 and they can work their way up to $10,000. And this isn't something that's covered by insurance. This is something your patients are going to be paying for, out of pocket, or they're going to be financing in some way. So, having a patient come in, take a hearing test, and then only having to pay, around $900 for this. I mean, that's really awesome. And these are things, of course, that will be covered under FSA, HSA spending accounts as well. So if patients have that money available to them, they could use that, especially as we come to the end of the year. People are wanting to spend that money. They forgot about it. They need to spend it, or they're looking at their benefits thinking, okay, well, if this is something I'm going to get, I maybe, next year I'm going to put extra in right now. So it's so affordable. That's the other thing I love about too, because when I first found out how expensive how expensive prescription hearing aids are, I was like, okay, I don't know how the majority of America can afford this, even if they wanted it, even if they knew they needed it, would help them. There's limits there. So, I love the price point. And the other thing, just kind of diving into a little deeper, is that, you don't have to carry, 10 sets in your pharmacy. That's not even advice. That's not even like what you say, to do. It's like, hey, carry a few. So that way, if you have someone who needs them, they can walk away that day with them. You can help them get the app set up and everything, and, and get them fitted. That's super, super easy to do. But, you think about a lot of the supplement companies, and you look at bringing brands into your pharmacy, and they're wanting a pretty hefty nugget in order to bring some lines in. So, this is something that's so super affordable, easy point of care test. And you can test, a ton of patients. I would recommend, if you're going to health fairs and vaccine clinics, offer the test for free. It's a great community outreach program. And then, say, hey, I'm here, this is free. And then have, like you said earlier, I'm real interested in these hearing days. I think that's a great way to get people into the store. Of course, there's other things as well that you can offer along with that, like a cognitive screening. I really do a brain checkup. We don't have these things checked, but we need to. We go and we get our teeth cleaned. We go and get our eyes checked every year. It doesn't mean we have a disease there, but we know that if something changes, we've been testing along the way to know when that moment happens, so we can proactively, get treatment right away. So I'm curious to hear your insight into how pharmacies are creating these hearing days.
Yeah, it's just starting to catch on. I always thought that the best ideas come from the people that are administering the tests and selling the product, and that continues to be true with the pharmacy community. So, very simple, 2 hours or 4 hours. Maybe it's Tuesdays and Thursdays, or just one Saturday a month, or whenever it may be a little easier for the pharmacy to assign someone to give the test, and then they promote it. In a local newspaper, or I'm hearing some radio, believe it or not, some folks do it that way. Just kind of depends on what works for them. Certainly all the signage and posters and the acrylic displays are helpful in the pharmacy. Some folks are really big on the emailing or using it as a part of a newsletter to their community, or whatever works for them. All of the above, right? I mean, it's just a matter of what they're comfortable doing. And if people really love the idea of getting their hearing checked and having that test available locally for the first time, probably in a very long time. So, yeah.
Yeah. And like we talked about earlier, there's so many communities where, just access to this type of care, isn't there. So it's a great opportunity for you as an independent pharmacist to provide this. It's a great talking point as well, Anthony, thinking about your physician referral partnerships.
Yes.
A lot of pharmacists go out and they talk to physicians about their services they're offering to say, hey, if you have anyone who's struggling with hearing, we're doing testing, takes 3 minutes. If we need to, we have the ability to refer on to an audiologist. If they test in a certain range, we will refer on, but at least we can get that baseline score for them and get them treatment as well, if needed. So, remember that as you think about it. And, your referral partners are really important. OTC hearing aids are a really hot topic right now. It's a really great point of care test that you can offer, year round. This doesn't have a season on it. This is something you can do, 365, or, if you're closed on the holidays, 363, in your pharmacy. So, so just absolutely love it. I think that this is going to be, this next year, one of the biggest point of care testing outside of respiratory that pharmacies are going to be offering. So, if you're an early adopter of new test, jump in now, and get this going and become that resource in the community, and use the awesome marketing material that Anthony has created. So, Anthony, I do have one more question. So the pharmacists that you've been working with that are the most successful pharmacists, is there any secret to what they're doing that you could share with everyone?
Nothing that's mind-blowing, really. It's just getting the word out, and that's probably the biggest secret, is making sure people understand that the pharmacies now offer another clinical service. And then just the other thing that comes to mind is sort of having a hearing champion in their stores, or two, if that first one's not around for any reason or busy, where they can understand the tablets, understand how to explain the test, understand how to interpret the results, use the patient brochure to help the patient understand that they would qualify, or not, or make the referral there on the spot. So, the knowledge of point of care testing in the pharmacy within their community, and having that store champion seems to be what's making those pharmacies successful. And the pharmacies also ask me, Tara, that is this Medicare reimbursed expense? So hearing is not, and you referred to it, right? So, major medical, dental, vision, and then there's sort of this line, and hearing's below the line, which is why the price point is so important, which is why we get a lot of folks kind of seeking an OTC option, especially if they are mild to moderate. Because I sold the prescription hearing aids, and they were on average over $4,300 per set. So oftentimes it can be $5,000 or $6,000 or $7,000. So this is quite a cost savings. Again, really great sounding hearing aid, the Soundwave OTC hearing aid. We designed it that way. We designed it to make sure that we customize the amplification settings, super important, and then just super easy and intuitive to use. And then we came up with the point of care test with the oToTune assistant, so that pharmacies can now offer this clinical service in their pharmacies.
Oh, I love that. And, the important thing too, getting back to the champion, the person who's going to drive the service for you, it doesn't have to be the pharmacist. Actually, it's probably best if it's not. It should probably be your cashier, someone who's in the front end, that person who is patient facing the most in your pharmacy should be the one who's trained on it. And all you have to do is be trained, and it's very easy. I trained myself how to do it without any help, really. It was very easy to understand. I got on a phone call with Anthony after I did it, and he just went over it with me real briefly, and I think I could go out today and do 50 of them. So it's really that simple and easy to use. So I encourage everyone to go check out Soundwave and the oToTune assistant, and bring this awesome point of care testing service that's very valuable into your pharmacy. And I think through this device we can help millions of patients who are probably suffering from hearing loss, and they're not seeking the care. They don't even know about it, or they've gone out there and they've been to an audiologist and they're like, oh, you're on the borderline. Would you like my $10,000 hearing aids? And they're like, not today.
Yeah. Right.
So, it's something that's a great price point.
Super. Yeah. And we've got a 45-day money back guarantee on the product. For any reason they don't want the product, or they buy it and it turns out they do have a more severe loss, they return it to the pharmacy. We reimburse you. It's a 1-year warranty on the hearing aids and the receivers. So we stand by our products, and we're proud that we designed and engineered and assembled this product here in the U.S. So it's been a fun journey for us, and it's been really a great partnership with you, Tara. So thank you for